Endometrial cancer develops in the lining of the uterus, which is called the endometrium. It is one of the most common cancer of the female reproductive system. Two types of endometrial cancer: type 1, which will occur around or after menopause and is often linked to excessive estrogen exposure, and type 2, which occurs in older women and is not linked to estrogen exposure. For symptoms, there are four: a watery vaginal discharge, an unexplained weight loss, difficulty urinating, and abdominal pain. The risk factors that may contribute to the diagnosis of this cancer are hormone imbalance. Excessive level of estrogen or hormonal tamoxifen treatment for breast cancer can increase the risk of endometrial cancer. Older age, endometrial cancer occurs most often after menopause. Obesity, having extra body fat can affect the hormone level, which increases the risk of this cancer. And fourth, diabetes. So there are two types of diagnosis. The first is laparoscopy, which is inserting a small tube with light and camera into the abdomen to check the tissue growth, and biopsy, which is examining a small sample of tissue under a microscope to determine the condition of the area. For the stages of this cancer, it's different from the other ones. There are four. It starts from stage 1. In stage 1 to 3 being the early stage and 4 being the advanced stage. Stage 1, there are substage 1A and 1B based on the size and location of the tumor. The cancer cells have spread through mucosa into the gland of the cervix, but not the connective tissue of the cervix. It has not spread into nearby tissues or lymph nodes. For stage 2, the cancer cells have spread into the connective tissue of the cervix, but not to the outside of the cervix. It has not spread into nearby lymph nodes or distant organs. For stage 3, there are substage 3A and 3B and 3C based on the size, location, and how far the tumors have spread. Typically, the cancer cells have spread to the outside of the uterus and to some nearby lymph nodes. In stage 4, there are substage 4A, 4B based on the metastasis of the cancer. The cancer cells have spread to the inner lining of the rectum or urinary bladder and to some distant organs such as lungs, liver, and bones. There are 5 treatments. The first one is surgery, removing the affected area such as uterus, ovaries, fallopian tubes, or nearby lymph nodes. And the second is radiation therapy, using the high energy beam to kill the cancer cells and prevent them from growing back. The third one is chemotherapy, which is using specialized medication to stop the growth of the cancer cells. And fourth, hormone therapy, which is blocking the hormones to stop the cancer cells from growing. And the last one is targeted therapy, using special medication to attack certain cancer cells without affecting healthy tissue. Targeted therapy is less harmful than chemotherapy or radiation therapy. So those are everything we have for this kind of cancer. And for the other 8 types of cancer, we have follow-up videos. Thank you for your time. See you next time.